How to remove leeches. If you've ever hiked in a rainforest, you've probably encountered a leech. For some, this is a traumatic, horror film-esque experience featuring a slimy, mini vampire, and gushing blood. Leeches live in moist undergrowth and grasses as well as freshwater areas. They attach themselves to warm-blooded animals, including humans, and can expand to 10 times their normal size as they fill themselves up on blood. If you find a leech on your body, don't panic, since they don't spread disease or cause pain. If you can stand the thought of letting the leech get its fill, it'll drop off on its own after about 20 minutes, but you can also remove the little sucker using nothing but your fingernail. Welcome to The Guardian's Choice. This video will tell you how to removing a leech, dealing with difficult leeches, and keeping leeches off your skin. Follow all the steps in this video for the best results, and don't forget to subscribe to get all the household tips and tricks you don't want to miss. Method 1. Removing a leech. Number 1. Locate its head and sucker. The head is the narrower part of the leech, and the sucker where it attaches to your skin. If the leech is located on one of your arms, legs, your torso, or another easily accessible area, you should be able to remove it yourself. Otherwise, you'll need someone else to help you take it off. If you find one leech, you should check your entire body to see if there are more. Leeches inject an anesthetic into your skin when they sink their teeth in, so their bites are painless. You may not be able to feel the presence of other leeches elsewhere on your body. Remember that leeches aren't poisonous and they don't carry diseases, so don't panic when you find one. Leeches are usually quite easy to remove and won't cause any long-term harm. Number 2. Slide your fingernail under the sucker. Use one hand to gently pull the skin near the sucker taut, then place your other hand next to the leech and slide one of your fingernails underneath the sucker. The leech will immediately begin attempting to reattach itself, so flick it off right away. Do not yank off the leech, since this will leave its sucker attached to your body. If you're squeamish about using your fingernail to remove the leech, you can use the edge of a credit card, a sturdy piece of paper, or any other thin object instead. Number 3. Treat the open wound. When leeches latch on, they inject an anticoagulant to prevent the blood from clotting before they can get their fill. When you remove a leech, it might bleed for several hours or even days before the anticoagulant leaves your system. Be prepared for the sight of profuse bleeding when you take the leech off. Cleanse the open wound with rubbing alcohol or another first aid cleansing solution, then apply a bandage to protect it. Since the bleeding might take a while to stop, you should change the bandage regularly. It's important to treat the area as you would any open wound, especially if you're hiking around in a jungle. Open wounds are more susceptible to getting infected in jungle environments. Expect the wound to itch while it heals. Number 4. Consider letting leeches fill up and drop off. If you can stand it, an easy way to get rid of a leech is by letting it drop off on its own. It takes around 20 minutes for a leech to fill up, and when it's done feeding it will fall off your skin. Leeches don't take enough blood for blood loss to be a worry here, and since they don't spread disease, there's really no harm in letting them fall off without intervening. The practice of letting leeches feed on human blood for medical purposes has been done for thousands of years, and leech therapy continues to be medically important. The FDA has approved the use of leeches to help with circulation problems and to aid in tissue reattachment. Number 5. Avoid removing leeches by any other means. You might have heard that you can remove a leech by pouring salt on it, burning it, spraying it with repellent, or drowning it in shampoo. While these techniques might cause the leech to release its grip and fall off, it won't do so before vomiting back into the wound. This can lead to bad infections, so stick to the healthier practice of simply using a fingernail or other straightedge to get under the sucker. Did this video help you? Let's comment below, yes or no. Method 2. Dealing with difficult leeches. Number 1. See how deeply the leech has burrowed. Sometimes leeches find their way into orifices, like the nostrils, ear canals, and mouth. This is especially common when you're swimming among leeches. When this happens, it can be difficult to reach the sucker and use the simple leech removal method. Do your best to remove it the easy way before trying alternative methods. See if someone can help you slide something under the sucker. Be very careful not to poke yourself, though. Do not use this method if you can't see the sucker. You can try to let the leech finish sucking and fall off, but if it's inside a tiny space it might get too big and cause problems. Number 2. Use alcohol if it's in your mouth. If the leech has attached itself to the inside of your mouth, you might be able to cause it to fall off by rinsing your mouth with vodka or another strong alcohol. Rinse it around your mouth for about 30 seconds, then spit. Check to see if the leech is gone. If you don't have alcohol on hand, hydrogen peroxide may also work. If the leech is still there after you spit, and doesn't fall off on its own, you need to seek medical attention. Number 3. Puncture the leech if it's getting too big. If you're in a remote area and don't have immediate access to a doctor, you might need to puncture the leech. Hopefully you will have been able to remove it via another method, but if it's in a really tricky place, like your nostril, you might need to pop the leech before it obstructs your breathing. To do this, take a sharp knife and simply pop through the skin. It's not going to be pretty, but the leech will die and you should have an easier time getting to the sucker. Remove the leech's body and immediately wash the area. If signs of infection occur, seek medical attention as soon as possible. Number 4. Get medical attention if it can't be removed. If you have a leech far up your nose, in your ear canal or in another place that's impossible to reach, go to the doctor to get it removed. The doctor will be able to use instruments to remove the leech without hurting you. Number 5. Get treated immediately if you show signs of a leech allergy. Few people are allergic to leeches, but it does happen. If you experience dizziness, a rash, shortness of breath or swelling, take an antihistamine, such as Benadryl, and seek medical attention right away. Did this video help you? Let's comment below, yes or no. Method 3. Keeping leeches off your skin. Number 1. Be wary when you're in areas known for having leeches. Land leeches are common in the jungles of Africa and Asia, and they're also found in freshwater lakes and ponds across the world. If you're planning a trip to a place known for having leeches, bring the right gear with you to minimize the chances that you'll get bitten. Land leeches tend to live in muddy and leafy areas in the jungle. If you stand in one place long enough, they'll start crawling toward you. Try to avoid touching trees and plants, and check yourself often for leeches. Water leeches are attracted to movement, so splashing around and swimming might put you at greater risk. Number 2. Wear long sleeves and pants. Leeches are attracted to the exposed skin of warm-blooded animals. Wearing long sleeves and pants will protect you from getting bitten, although you'll probably find leeches trying to get through the fabric. If you're especially concerned about getting bitten, wear gloves and a head covering so that no skin is left exposed. Wear closed-toed shoes instead of sandals. If you're planning a longer jungle expedition, it's worth investing in a pair of leech-proof socks. Number 3. Use insect repellent. While this isn't a foolproof measure for avoiding leeches, it'll prevent them from piling on. Spray your skin and clothes with a standard insect repellent, and reapply it every few hours while you're in a leech-infested area. Here are a few other tricks you can try to repel them. Put loose tobacco in your socks. It's said that leeches don't like the smell. Rub soap or detergent on your hands and clothes. Did this video help you? Let's comment below, yes or no. Tips. 1. To prevent leeches from latching on in the first place, wear closed-in shoes and higher socks. Also, insect repellent on your body will prevent them from smelling that you are nearby, so they will be less likely to latch on. 2. check your feet and legs or any other part of your body that may have come into possible leech territory, so that you can identify them before they suck too much blood. 3. Leeches die when covered in salt, or wrapped into a tightly coiled ball of tissues. The salt and dry environment of the tissues soaks up the leech's moisture, causing them to therefore shrivel. But this may cause them to vomit blood onto your wound, which can severely increase your risk of infection, which can be fatal. 4. If you do happen upon a dying leech, try to remember that it's just a helpless creature who needs a meal. 5. Keep in mind that not all leech species suck blood. Warnings. 1. Leeches will also attach themselves to outside household pets such as dogs and cats. Low-to-the-ground animals may also get a leech in their eye. If this happens, do not pull it off or rub at it. Do not put salt on it. Wait till it drops off. The animal's eye will be swollen for a day or two, but otherwise it should be okay. If not, see a vet. 2. Don't use shampoo, salt, or insect repellent on the leech while it is attached to our body, as the leech might regurgitate back into the open skin and cause infection. 3. Don't pull or tug at the leech. 4. If you suffer from many leeches that are also very large, see a doctor. Choose the method that works best for you and your situation, and help to remove leeches. Follow this channel to learn many more household tips, tricks, and life hacks like this. If you have other tips, please share them with us in the comments. Hope you enjoy. See you in the next video.